Hi, everybody. Thank you for joining us. We are going to get started in just 2 or 3 minutes, but we're going to give folks a chance to get signed in. Please be patient with us. We'll be here soon. Thanks. Hi, everyone. For those of you I don't know, I am Aimee Lewis. I'm the Chief Development Officer and Vice President of External Affairs here at Planned Parenthood of Tennessee and North Mississippi, and it's my honor to welcome you to our annual talk. You're going to hear today from our fearless leader, Ashley Coffield, our CEO, our Senior Manager of Education, Victoria Freeland, and Francie Hunt, our fearless leader of Tennessee Advocates for Planned Parenthood, and our Director of Organizing and Advocacy on the C3 side as well. We are going to have a few minutes, hopefully, at the end of the call for Q&A. So please, if you have any questions or think of any while folks are talking, drop that in the Q&A portion at the bottom of your screen, and we will try to get to them as we're able. So thanks for joining us, and Ashley, take it away. Ashley, you are on mute.
Here we go again. Hi, everybody. I'm Ashley Coffield. I am so happy to have all of you here today with us. Thank you so much for everything that you do for Planned Parenthood and for other progressive causes in Tennessee. Y'all, it is no secret that we're living through a dark moment in American history. The loss and grief we've experienced over the past 2 years, from the overturning of Roe v. Wade and now to the 2024 presidential election, has been traumatic and unrelenting. And in this moment, it's understandably hard for any of us to feel hopeful. I want you to know that even now, there is so much growth, hope, and light to celebrate, both for Planned Parenthood and for all progressive Tennesseans. The stories and statistics you'll hear are indisputable proof that no matter how bleak things may seem, all is never lost when we stick together. Our strength is epitomized by the grand opening of our new Knoxville Health Center. That's physical proof of Planned Parenthood's resiliency. When I stood in Knoxville nearly 3 years ago after the arson attack, surveying the charred rubble of what was meant to be our new Knoxville home, the grief, anger, and hopelessness I felt seemed insurmountable. Yet we reopened this fall, celebrating together, because as long as there are people who believe in our mission and are willing to turn that belief into action, Planned Parenthood will always be here, no matter what. Since we reopened on October 14th in Knoxville, we have already seen 502 patients, providing vital, high-quality, non-judgmental sexual and reproductive health care to East Tennesseans. In addition to this achievement, in fiscal year 2024, you helped expand reproductive health care and education access and advocacy efforts by donating over $8.5 million to Planned Parenthood of Tennessee and North Mississippi. Wow. Thanks to the federal Title X Family Planning Program, in our first 6 months of being back in that program, we were able to provide over $1 million in free and reduced cost services. We navigated 388 patients out of state to access needed abortion care and provided almost $300,000 in assistance for abortion patient travel and other free and discounted services before we had the Title X funding. We've been in our second year of providing birth control pills, emergency contraception, and UTI treatment through PP Direct, which is our app. We've served 407 zip codes and 78 Tennessee counties with 2,751 prescriptions. Even more exciting, we've expanded PP Direct to Mississippi this past June, and we've treated 81 patients there, and we look forward to serving many more. Our in-person and telehealth gender-affirming care services continue to expand with 2,678 patient visits last year. As we look to 2025, I want you to know that we anticipate continued federal and state attacks on reproductive health care and bodily autonomy. Just yesterday, the Supreme Court heard arguments in the lawsuit brought by the ACLU and Lambda Legal against Tennessee's gender-affirming health care ban for minors. Tennessee is pursuing a dangerous path in this case by seeking state power to determine what care patients can and cannot receive. Healthcare decisions should be made by patients, their providers, and trusted advisors like parents. It's immaterial how you feel about sex and gender. This intrusion into private life won't stop. This should be a moment of solidarity for anyone who cares about receiving health care with some expectation of bodily autonomy. Y'all, we have not heard the words defund Planned Parenthood in a minute. What does that mean? This means a state or federal effort to prohibit Planned Parenthood from participating in Medicaid, which is subsidized insurance for low-income people. In Tennessee, we call it TennCare. It also means preventing Planned Parenthood from competing for state and federal grants and contracts meant for healthcare access, like the Title X Family Planning Program, or to address public health challenges like HIV. Defunding is the tactic of authoritarians. They don't agree with you politically, so they punish you when they have the power to do so, even though they're the ones who politicized healthcare to begin with. Because abortion is more popular than Donald Trump and so is Planned Parenthood, at the federal level, they may come at us sideways. This is what we want you to look for. They may attack us and defund us in the name of government excess and efficiency, or they may allege fraud and abuse, like the state of Texas did to our affiliates there. But they will come after us. Elon Musk and Vivek Ramaswamy announced they will defund Planned Parenthood in their recent Wall Street Journal op-ed about their so-called Department of Government Efficiency, or the DOG. I'm not making that up, that's what it's called. At the state level, our opponents are empowered by this Trump win, and they will come after us with everything they can. And we will fight back every time. We will resist, and we will continue to show up for our communities. We will center our values of equity and justice through care, education, and advocacy. This is not a time for despair. Nothing is linear. When we stick together and stick with what we've built together at Planned Parenthood and in other ways across our state, we will go through this process and come out on the other side together. We've done this before. We will survive. We will find a way to thrive. I want you to know this. We will need you. Do not feel despair. Our advocacy works. Your advocacy works. We must delay, 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 delay. So every single person who needs us can get the care they can for as long as they can. We need you. Thank you for standing with us now and in the years to come. And now I'm going to turn it over to our Senior Education Manager, Victoria Freeland.
Thanks, Ashley. Hi, everyone. I'm really excited to be here today to talk about one of my favorite things, which is education. So during our 2024 fiscal year, we took a really sort of strenuous look at our education programs to make sure that we were strengthening them by listening to all of our participants who are, taking all of our education programs, making sure that we're continuing to build those creative partnerships and focusing on making our education really accessible to everyone, right? No matter their age, no matter their race, right? And we really want to make sure that our programs remain timely, inclusive, and rooted in reproductive justice. So, this year, we're really excited to announce one of our standout achievements, which is distributing over 1.2 million condoms and safer sex supplies in our region. So we've been able to really highlight the launch of our mail order program, which is designed to be able to reach rural communities with these supplies, along with the relaunch of our website, which is called freecondomstennessee.org. These efforts have really significantly expanded our access, everyone's access to condoms and safer sex supplies, not only in Tennessee, but also in Arkansas and Mississippi. To make all of this possible, we've actually redesigned our website so that folks can shop for condoms for free. So it's an easy to use storefront, helps users find what they need. And since its launch in January 2024, we've already processed and shipped 2,000 individual orders out. In addition, we've expanded our condom distribution network, and this includes 192 partners over the last year, 73 of which of those partners were new. So partners that we have never interacted with in the past. And these really range from all different types of places, right? Senior living centers, college campuses, barbershops, addiction recovery centers, you name it, that's a place that we want to be present. Together, with all of these initiatives, right, we're really trying to make safer sex supplies more accessible than ever before in all regions or in all areas of our region. I also want to touch on our youth advisory board. So we took a fresh sort of look at our peer education and started our Tennessee Youth Advisory Board, where we have young leaders from ages 14 to 24 be able to step up and bring health education to their communities. Our board is really about sharing knowledge, building skills, and working on community initiatives that each board has selected. Our crew this year is about 20 young people from all over Tennessee. They bring extremely diverse perspectives to the table, and they're being able to take action right now, which is really what young people want to be able to do. So if you are a person who speaks young people, we can call this program lit, fire, iconic, a vibe, all those things. Our sex educators across the state have put in a total of around 300 hours in sex education training. We've reached around 900 people, and we've also handed out nearly 20,000 mutual aid supplies. And those are things like emergency contraception, pregnancy tests, menstrual products. And that's really a huge sort of shout out, right, to our incredible forward-thinking educators and team for making all of that happen. They are really the ones who are on the front line, making real change and building healthier communities. And none of this would be possible without them. Next, I'll talk a little bit about the state of HIV in Tennessee. When the state of Tennessee rejected federal funding for community-based health organizations that provided that frontline HIV and STI testing in early 2023, the impact that we saw was really immediate and devastating. HIV and syphilis rates since that happened have skyrocketed in our communities. To put it into perspective, within our health centers, we saw three positive HIV tests in funding year 2023. In funding year 2024, we saw 42 tests that were positive. So that is a 14-fold increase. We in the education department and at Planned Parenthood refuse to sit back and let this crisis grow. Alongside with our community partners, we're doing everything that we can to catch new infections early and connect those folks to the care that they need. This includes hosting our pop-up HIV testing events, navigating people to PrEP and PEP services, and ramping up our sex education in areas where it's needed most. In 2024, our sex education team certified 23 HIV outreach testers, and our health center provided over 28,000 STI and HIV tests. So we are in this fight together with our community partners, and we really will not stop until we make sure that everyone has access to the care that they deserve. Now I'm going to talk a little bit about our East Tennessee educator, Noe Menorahs, who has developed a groundbreaking curriculum this year for folks that are in recovery from substance use disorders. We are piloting this program currently at a recovery center in East Tennessee, and this program is already making an impact, and we are actually have the opportunity to expand that to more locations in 2025. So we're really excited to be able to provide this very essential education that's oftentimes very overlooked for folks that are in their recovery journeys. And for 2025, I have a little quick announcement. We're kicking off something that's new. We've done Askable Adult in the past. So this year, ahead of the inauguration, we are hosting a 4-part series that's called Empowering Conversations, Navigating Young People's Sexual Education with Confidence, Understanding, and Care, which as a parent or a caregiver can be difficult to do. So this series is designed for parents and caregivers of children of all ages, and we'd love for you to join us. We'll be meeting every Thursday in January virtually, starting on January 9th from 12 to 1:15 p.m. Central Time. And during these sessions, we'll have conversations about childhood development, conversation starters, tips for answering those tough questions when they do come up, which can be very surprising, right? In the car, in the supermarket, they can come up really whenever. So we'll put a sign up link into the chat, and obviously feel free to share this opportunity with all of your friends and family who are interested. So now I'm going to turn it over to Francie Hunt, our fearless leader, executive director of the Tennessee Advocates for Planned Parenthood, and on our C3 side, our advocacy and organizing director. So Francie, over to you.
Hi there. So glad to be on this call. Thank you, Victoria and Ashley. I'm really excited to share the work that we're doing. For many of you, this is not going to be the first webinar that you've joined us this fall, but I would be remiss if I didn't talk about the extraordinary political strength our movement has gained in the past year. The numbers I'll share in a minute make it clear that Planned Parenthood of Tennessee and North Mississippi and all of our progressive coalition partners across Tennessee, we possess the strongest organizing power in the state, and that power, coupled with significant investments in Tennessee Advocates for Planned Parenthood, which is Planned Parenthood's 501c4 advocacy and political legislative arm, and our C3 advocacy team, has resulted in historic levels of voter reach and momentum and held the line for all of the seats that we couldn't afford to lose. So despite our disappointment and the frustration at the ultimate outcome, we must not overlook how truly exceptional and exciting these numbers are. We may be forced to play the long game right now, but by maintaining these levels of engagement and investments going forward, we know this is a game we can ultimately win. Okay, so just to be clear for legal purposes, I'm wearing my 501c4 TAPP hat right now. And so in 2024, TAPP organized and led the largest strategic field program in our history. We had the largest independent expenditure phone program in Tennessee with over 100 people hired to pay calls, and it included electioneering and get out the vote efforts. We also, because of that, we increased the amount of leaders that we were able to develop, because if you can work a phone, you know how to do the basics of organizing. And so we have like 100 new great callers in the state. We also hosted over 30 weeks of volunteer phone banks called TAPP Tuesdays. You probably heard of them, leading up to the election. And we initiated our Deploy Davidson program, taking volunteers from Davidson County and funneling them into electioneering and advocacy efforts in neighboring counties. And we drastically scaled our voter registration involvement this election season, with voter registration activities implemented by our entire advocacy team, including, and very importantly, RIEs, our Black organizing, youth organizing, Generation Action, and Action Council programs. TAPP endorsed 77 state candidates in the 2024 primary and general state elections, and we focused on 4 key state house districts. All of this led to over 1,000 volunteers and paid staff phone banking, door knocking, and advocating during this election cycle. They made over 200,000 dials to voters, 20,000 texts. We knocked over 40,000 doors and had more than 17,000 conversations with voters. And all of the information that you're getting are definitely hot off the presses, because both Ashley and I just came from DC for a post-election summit, and I'm calling from the airport right now. So you may hear some of that background noise, but I'm glad to be able to give you some up-to-date information today. So in addition to all of this, we also mailed over 27,000 pieces of mail to voters, and our digital ads had 9.3 million impressions, with almost 60,000 of those viewers completing the videos in their entirety. I mean, I can't tell you just how much of a monumental effort this was. We had the largest financial and people-powered investment TAPP has ever undertaken. Understand this, our efforts have not been wasted. They've not been wasted. We know that power building happens year-round, and this election served as a launching point for future advocacy efforts. TAPP laid it all on the line this year, and I'm so incredibly proud of our work and our movement. In 2025, we will continue investing in our communities, developing grassroots movements, and striving for a better future by expanding our Action Council programs, holding anti-repro rights legislators' feet to the fire, and continuing to engage the voters we reached this past year. Though we can't control the chaos that lies ahead of us on the state and federal level, we can refuse to be consumed by it. We can dedicate ourselves to growing those numbers and that momentum in our communities. We can enter this period of resistance together, bound by these core beliefs. You will not tell pregnant people what they will do with their bodies. You will not vilify Black and brown people. You will not attack trans kids, and you will not deport people who need sanctuary. Together, we are courageous, we are resilient, we resist, and we are hope dealers. Thank you so much, and I'm going to turn it back over to you all.
Thank you, Francie, and same to you, Ashley and Victoria, for sharing our progress with everybody and giving us some inspiring words at a time when we really need it. So just wanted to kick things off with a question about what will happen if Trump enacts a federal ban. What will that mean?
Well, I'm gonna ask Francie to jump in on this too, but let's take a step back. We know that Trump backed off on abortion during the campaign. He realized how unpopular abortion bans are, and he actually got elected without really the need to have the far-right anti-abortion movement behind him. He really dismissed them during the election and really kind of did his own thing. That doesn't mean that he's not going to sign a national abortion ban. We don't know, but that needs to be a little bit of context. For Congress for him to do it administratively would be impossible, really. They're going to need the Congress to do it. And they don't have 60 votes in the Senate for a national abortion ban, but they could do it through reconciliation, where they only need a majority in the Senate of instead of 60 votes, they only need 51 votes. And so that's possible, but it's unlikely. So again, anything is possible. We have to be ready for anything. But I think that I think coming at us sideways, not just Planned Parenthood, but coming at abortion sideways is highly likely. And there's lots of different ways that they can come at it sideways. Francie, do you want to add to that?
The only thing I would add is that, I mean, I think it's important to see this as a win in some ways, because you had the right wing all the way from the federal candidates with Trump kind of backing away from being anti-abortion, to also locally in all of our districts where we were fighting so hard, you saw the right-wing candidates backtracking, saying, "Oh no, we're not, opposed to exceptions. Oh no, we would not be for, blocking contraception or IVF," which paves the way to, a little more hope than we had initially thought. So I think that is a win that we ought to recognize as well.
Another way to come at it sideways is to attack mifepristone and the ability to, deliver it through the mail. There's lots of different ways that they could come at it from a different angle that's not as easily understood by the public as being an abortion ban, and so that's really what we're really concerned about.
So Ashley and Francie, what do you foresee coming up in the new legislative session here in Tennessee come January?
Francie, you want to take that?
Yeah, I think that there's going to be some legislation. I think they're calling it the South Star Bill, that will have several different components. Some will include being able to clarify the language between contraception and abortion. I think that I heard that Senator Ackberry also has her bill that she announced regarding that. We could also anticipate some more exceptions being put forth. And I think this might be a way for us to kind of also push forward on some more maternal health bills as well. But I think contraception and IVF protection are probably frontline considerations. I think the whittling away of the right to contraception will be similar to how we see the ban on abortion, that it'll be like death by 1,000 paper cuts. So it may be where it might be a right to religion or a right for an employer to deny health insurance coverage for certain kinds of contraception. It's not going to be a sweeping piece of anti-contraception legislation necessarily. So I think we're just going to have to keep our eyes and ears out for those kinds of things, and kind of hold those legislators accountable, those incumbents that won this year, accountable to the promises that they made to not backtrack on repro. We shall see.
Thanks for
Yeah,
that.
I agree with what Francie, I'm sorry, Aimee, I was just going to add one other thing, that, the way that you come at contraception is not to ban contraception. I just want everybody to be really we have to fight for all these little things around contraception as hard as we would fight against a ban, because that's how they chip away at our access. So we've got to stand firm on anything that they try to do around contraception. And one of the most dangerous things that they could do is a parental consent law, requiring parental consent for contraception for those under the age of 18. And for those of us who've enjoyed bodily autonomy for decades and known that our young people have it as well, I think that's super high risk. Super high risk. And it's going to be framed under the mantle of parental rights. It's not going to be framed under the mantle of contraception at all. And it's not going to only capture up contraception, but other things that minors can consent for, like STI testing.
Okay, we've just got 1 minute left, but we have one question left in the Q&A, so hopefully we can answer it pretty quickly, but it seems like a biggie. With such a focus on, quote, the economy being cited for reasons for voting the way people did, are there resources, data, etc., that compare overall costs of sex-positive care compared to places without, and how average healthcare spending changes per person? Is there anything in like our maybe insurance, how they reimburse care, or
I'm so sorry. Can I see the question, Aimee, or is it possible for me to see it?
yeah, give me a
I have a hard time listening when it gets past like a
s-
certain number of words,
um,
like my brain goes, I'm a
well,
reader and not a listener.
let me see. If you click on the Q&A at the bottom, you will be able to see it at the
Okay,
top.
I see it. Thank you, Gail. Okay. Oh, okay. I kind of see yeah, I see what you're saying. It's a really good question. I mean, yeah. I mean, we know that Tennessee has worse health outcomes because we don't have Medicaid expansion, because we have an abortion ban. You know, we know that the policies that our state has enacted has created, you know, worse health outcomes, and then people end up in the emergency room. And it's, you know, I mean, it's just, you know, there's a cascading effect on people's pocketbooks, you know, as a result of not just making basic investments. Maybe I'm following you there. I mean, states like Minnesota, for example, that have invested in all kinds of good, positive things around abortion access and Medicaid expansion and comprehensive sex ed, and, you know, supported minors who need access to reproductive health care. Their health outcomes are great. You know, they have superior health outcomes. They have a healthy population. It's a place where employers want to go and open businesses and hire people, and, you know, all those kinds of things. It all has a cumulative impact.
And I can also add a little bit
Yeah.
here. It's so interesting that this came up because I was just in a seminar about this the other day where we were talking about cost saving that happens because of Title X services that are offered to people. And a good resource, if anyone is interested, is always Guttmacher. They have tons of information about how Title X and investment in reproductive health services on a federal level lowers healthcare costs overall, if anyone is interested in looking into that.
All right, y'all. I am going to bring us to a close because we promised you a quick 30-minute call. Thank you all so much for being here. There will be a recording of this going out in our newsletter this weekend, so be on the lookout for that. And I look forward to seeing you all. I hope you have happy holidays, and thank you for supporting Planned Parenthood.
Thank you, everybody. We appreciate you so much. Happy holidays.